Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative, Orthopedics, and Sports Medicine.
We're visiting our friends at ROSM again today, Regenerative, Orthopedics, and Sports Medicine, to discuss the benefits of PRP, platelet-rich plasma, and this therapy and how it can help those with osteoarthritis seek non-surgical solutions for their pain. Who better to ask than Dr. Nettey with ROSM. Thank you so much for joining us here today.
Thank you for having me.
I want to talk about this. A lot of people do struggle with knee pain due to osteoarthritis. Yeah. And why do traditional treatments often leave them feeling rather helpless?
Yeah, honestly, so osteoarthritis is due to wear and tear of the cartilage in the joint. And so it starts off from when you're young because we start crawling, walking, jumping, running, everything. And so everyone's going to have osteoarthritis at some point in time. It just depends on what level, either if it's mild, moderate, or severe. And so when you start having those twinges of pain, first step is to take some Tylenol, ibuprofen, something like a pain medication. Next step, if it continues and those medications are helping, people traditionally get steroid injections or later on a hyaluronic injection. And then once those don't work, along with physical therapy, strengthening up your glutes, your thighs, making sure you float your knees a little bit more, then they go ahead and go to see an orthopedic surgeon. And then the next option is surgery. Well, not everyone's ready for surgery. And so going this incremental step typically frustrates them, especially my workers who are like, I can't take time off from work. Right. This is not really feasible for me. So what's the in-between option? And
that's where platelet-rich plasma, PRP, comes in. Bit of a game changer in knee osteoarthritis. Can we explain that?
Yeah, so platelet-rich plasma has been out since the 1970s. It was thought about in the 1970s, 1980s, dentists started using it, and in the 1990s, sports doctors started using it, saying, hey, it's actually helping to decrease pain in the joints and regenerate a lot of the cartilage that we're losing from osteoarthritis. And so it's a game changer because it's that in-between option when people are not ready to do surgery yet. So we have something that's options. You can actually do it.
Options are good, right?
Yes, options are great.
Can you just walk me through it a little bit, what they expect and how the procedure works?
Yeah, so for all our patients, we have them come in about 30 minutes early. This is after we've talked to them in nauseam about this. So we have long conversations with them. All our visits are 30 minutes to 60 minutes. And so they get a lot of time with us to go over it, go over their images, and then decide if they want PRP. When they come in about 30 minutes early. One of our MAs draws the blood. It's not only a small amount of blood. And then they take it to a centrifuge. In that centrifuge, they spin down the blood. So it separates between red blood cells, white blood cells, platelets, and plasma. We take that plasma and the platelets, separate the platelets, put them aside, and then we even concentrate them even further. And then that's exactly what we inject into people. So we are injecting platelets, which are basically the firefighters of our body. They come in, they see what's torn, what's not working, and then they call everybody else in to come regenerate things.
So basically you're taking something that your body creates and just kind of, putting it together, magnifying it somewhat,
exactly.
Right? And then helping your body help itself.
Yes, and for my natural people, they're like, wait a second, it's my body? I'm not putting something no, it's your stuff.
So if those are watching at home that have had knee pain, what the first step is just to come in and make that appointment, do the consultation?
Yeah, so if you're curious, if you're like me, you need to look over everything, which I am one of those. I go to ROSM.org. That's one of our websites. We have a lot of information on platelet-rich therapy, anything else that we do. Then schedule an appointment. Like I said, our appointments are 30 to 60 minutes long, so we have time to talk to you about this. We're not going to rush you out the door. And so just get a hold of us.
Make it happen. Okay, thank you so much.
Thank you.